Okay, so today I'm going to talk about Lyme disease in dogs.
Push down.
So what is it? It's a bacterial illness that is transmitted by ticks. So it's caused by that bacterium, and it's spiral shaped. And then the bacteria can spread throughout the body via the bloodstream, and that's where you get most of your problems, with if it's the organs or just overall the whole body. So ticks can transmit the disease between 24 and 48 hours, and basically it's just inside of the tick, so when they bite your dog it goes through the bloodstream. So this is just a map of like the areas that have the most risk. So like the red, you're probably going to get it with your dogs. The orange is like where we are, so it's a moderate risk. And then the yellow is like slight risk, so there's less cases. So the primary carriers are known as the black-leg tick or deer tick from here and out, and like Colorado and stuff, they call it the bear tick. So the habitats are your wooded, brushy areas, marshes, and tall grass. And tick season is basically from October through March, but they're more active during October or like hunting season. So if you have a hunting dog, it's pretty common to get a preventative. So this is just a cycle. So you have like your female and then the eggs and the larva, but they don't transmit the disease until they're nymphs. And then when they're adults is when it'll become more of a problem. So your symptoms that you'll see in your dog are fever, loss of appetite, reduced energy, lameness, swelling of joints, and then kidney failure, which is if you don't catch it. So then there was 2 tests that the article talked about, and they're both blood tests. So you can get an antibody test or a PCR test. And the one picture showed this, so I don't know if it's for both of them. But basically it checks for heartworm and Lyme disease, and then these are the 2 things. And then your vet will give an examination to see like the symptoms that you've told them about. So then the treatment would be to administer an antibiotic for several weeks. And then you should stay away from wooded areas and tall grass. And if you see a tick on your dog, remove it. And then I read about a vaccine, but it didn't really say much about it, so I don't know if it's available right now.
We're going to ask the audience when we get done.
But you can also get the Seresto collar, which is what I use for Dixie because we take her out in the woods all the time. So that was our best way to prevent it. And then we always check her after we get out of the woods and then when we get home, just in case there is any ticks on here then. So.
And even tall grass,
Yeah.
right?
So, I mean, humans can get Lyme disease too, but it's not very common because you don't really walk through tall grass. So.
You ready for questions?
Yeah.
Now, could you go back to the slide where it showed the SNAP test? Because you guys do that more than me. Isn't it an antigen test?
It's antibody or antigen. That SNAP test is antibody.
Oh, okay. Because see, I was thinking it was looking for like a part of the heartworm, and you would call that an antigen test.
For the heartworm, yes, but like usually they have like the heartworm and Lyme combined. As a
Oh,
SNAP
okay, that's right.
test.
I'm thinking heartworm, and this is
Yeah.
Lyme. Yeah, that's where I messed up. Okay, so this is the antibody
Yes.
test. Okay, got it.
PCR test is something that you have to send off.
Yeah, you can't do that at
It's not a
home unless you have
SNAP
quite a lab. So
Yeah.
I was thinking heartworm. Yeah. So.
Well, because the one picture it showed all of those tests on one, but then this one just showed the different spots. So like.
Oh, I see. Because different spots are different.
That's the
I got you.
control dot, right?
Yeah.
Yes.
So then, like, if they had heartworm or Lyme.
Okay.
Yep.
Now, where's the control at?
So the blood is up top, the control is the bottom. So that bottom circle, so you have the area, and then you have the bottom circle, that's the control circle. knowing
Okay,
the
so
blood's
then
gone
when
through.
it goes bad, what is this?
So that'll turn brown.
It'll turn brown.
Yeah, so you know, it'll show, because they'll put the blood on top, usually do blood and then like 3 drops of serum, and it travels down and then it gets to your control, and as long as your control's red, that means the blood has gone all the way through. And then it'll show like a darker spot if it's heartworm or
Okay.
whichever you're looking for.
So this is doing 4 tests, basically, yeah.
Yes,
Right.
it can, with that
It can, with
particular
that.
SNAP test, but that one is actually really expensive,
I
so
bet
let's
it would
just
be.
do the heartworm and Lyme.
Yeah, okay, I got it. Yeah. Okay, yeah, now my question, I was thinking heartworm.
Yeah.
Because that's a heartworm
Yes.
antigen test, yeah. Other questions? Because Lyme disease is, up north there's plenty of people with Lyme
We
disease.
see a lot of it, so.
Yeah, yeah, I mean, yeah, people, so, yeah. And how about the vaccine? Isn't there a vaccine for dogs?
So
There's a window.
it's more of like, with the way that we do it, you can do it as a preventative, but it's not a very good, it's like, I think they said it was like 64%
Response?
effective, yeah,
Okay.
response. Usually what we do is if the dog has had Lyme disease in the past, we just treat it symptomatically, and then once the symptoms are gone, then they'll start every time they get the distemper, because you can get the distemper Lyme combo.
Okay, okay.
Then they'll get
Then
that
we'll do
every
it.
year.